hopefully, is Nick in the audience? If
No,
Nick
not
Weston
yet.
is not in the audience, if we
I
can
think he was
find him.
outside.
If we can grab Nick Weston, wonderful. I think Simon is here. Yes, we've got Liz on, so that's good. And Phil and Helen are here. So everyone, we're in the final session, and we will try and finish on time. So I know we're running a little bit behind, but that's fine because we've got enough time to, I think, do justice to some of the ideas and thoughts and reflections that have come out of the 3 workshops. So I was at the Sandbox workshops, so fascinating, and I know each workshop will have their own fascinating ideas. So we're going to start with, Phil and Helen, you wanted someone to report back, and who might that be so they can come to the stage?
I did nominate someone, which was a bit wicked of me, but I know that he'll always give a straightforward
Excellent.
opinion of what's happening.
Would you like to come to the stage and share?
I'll let him introduce himself.
I will stand aside.
Yeah, thanks, Helen. You don't mind giving 3 minutes at the end, do you?
Sorry, I'll just take this away.
Yeah, I'm Jamie Sheridan, involved in innovation technology development. So I've got particular interest in healthy ageing and different things I've done, backgrounds, orthotics, prosthetics, so different projects. Very much working with different companies in healthy ageing technologies. I'm going to just do a quick run through of the businesses. We had a little bit of problems with technology, so 3 years after COVID, we're still struggling getting, get everything going. But it was very interesting in terms of health tech. It was quite a good mix of different businesses. There you go. So I'll run through them very quickly. But then there's perhaps a couple of notes as well, bringing everything together of where the vector is, if you like. So first, there's 10, so I'll run through the 10. Will Drake at Proteins, Early Diagnostics Institute, very much looking at proteins, how they can diagnose. Ira Milosevic, looking at aging in the human brain, the synaptics, various condition-based. Josh Burl from MasterCard. I did ask him for some money for sponsorship because I felt if you're going to stand up and say for MasterCard, I think it's worthwhile getting that. But he was looking at frictionless technology for payments. Now, there's obviously stuff going on with International Longevity Centre, which we mentioned to him, in terms of retail knowledge, but he wasn't really looking at that. He was looking at more the American model, which is private health, and if you go in health, you get knocked down, where's your credit card type thing, and I think that's a much longer discussion. It had some interesting points. Vanessa from My Strength app, looking at waiting lists, physical, mental health and well-being care. It's a busy market, really busy market, in terms of what's going from there. Helen was able to say there's a lot of stuff that's moving forward with Innovate UK in terms of the mental health aspects of things. Longevity obviously fits into that. Dr. Shamaraman, Flow Create, neuroscientist, looking at flow states. Neurocreate, creative thinking ideas, improvisation insights. AI design, which first I've heard AI once today at least, but I'm sure it's around different things. Mandy Dixon from the Northern Health Science Alliance for the Healthy Aging Network and various activities that they're doing. Rachna Lavika, Connected Places Catapult, so overview of the healthy aging activities. So it was really interesting seeing all the different projects coming together. So if you like from the SMEs, the startups coming through to actually the Catapult from the Connected Places, bringing everything together. We then had good boost from Ben, who was sitting there a minute ago, but he's not from there. Again, that's Active Solutions, another funded program. Is that Design and Aging? That's fun. So it's a social venture, bringing various levels of MSK, activity, active solutions, therapeutic solutions into the workplace. They were looking at making... He had a figure of 90,000, so if you're looking at reducing pain, function, quality of life, or even improving pain, function, quality, he reckons 90k of health benefits, which I'd love to quiz him about, but that's... but transforming jobs into MSK community hubs. It's a social ventures SBRI, was it? Place product and people, 1,500 gyms, but they're aiming to link in with 380,000 individuals. So that's a real headline number of that generating that movement. Sharon, USA social gerontologist, who was great eventually when she was able to come on. Very much seeing, the Americans have a totally different way of looking at things than we do in terms of we don't have the NHS which sorts the markets. They're looking at lots of different levels. She gave a really good talk talking about the National Institute of Aging, so I'm sure there's some connectivity after that, after this. And finishing off was Nicola Dickens from Profits for Purpose in Sheffield Uni, which shows talking about social enterprise value, various key value indicators, change based on commissioner values. She made a point of that change is based on commissioner values rather than actually what's best for the patients, and then that means that people drop out of the projects because they don't trust it, and trust was a big thing. Now, just to finish off, there was it was really interesting. I'd have loved to have more discussion, and I think this is a danger with this type of event, that it's crammed with so much information. We didn't perhaps get the chance to have a discussion about some of the stuff that's going on. But one of the things that came out of, I think, Ben's talk was about rehabilitation professions, the allied health professions, and I think we talked over lunch about possibly a mapping, mapping the clinical side of things, the academic side. I'd love to see us focus more on some of the SMEs, the startups, the industry, because that's where I come from. Anyway, there you go.
That's brilliant.
Okay.
Just what needs to come out, just say on the discussion point going, I think one thing we'll send out some information post event, but again, that might be an action we can take more discussion online and then after this, so yeah, great point there.
Oh, these lights are bright, aren't they? That's all right. So, has everybody had a good day? Yeah, good. Excellent. So we talked about care at the crossroads. So the theme was, is care a crossroads of action? Do we continue with a reactive model, or do we need to move to a more proactive care model, and how do we do it? So that was the overarching theme. We had Dr. Ian Philip who was our virtual chair, and he used to be the former czar for older people in the UK, so a real base of understanding from that perspective. So throughout the theme, there was some good feedback, some good interaction. We had a number of polling questions, which I can share some results with you. So we asked, care at the crossroads, without change and investment for the future of care deliveries in social settings is in danger of not being able to meet service user need, unable to meet demand, putting service users at risk, and unable to attract new people to the profession. Overwhelmingly, people said we were in danger of not being able to meet our basic requirements in terms of delivery of care, that if we don't change and we don't invest. So, great to see. I think when I say overwhelming, 77% of the people, so I think obviously that is overwhelming and really a clear statement from the people in the room and as to what needs to or where the risk is for if we don't develop our services. We looked at workforce and needs and training, and we talked a lot about things like language we use and how we position technology. I'll get on my soapbox. I always get on the soapbox about this. But just when I say language, I use things like the word digital. When you talk to somebody on the front line, digital is a barrier. I haven't talked about digital since the 1980s when I talked about my digital watch. We use these words and we talk about digital transformation. Actually, the thing that needs to happen is transformation. The word digital does not give us any value. It's a buzzword. So when we talk about that in our training sessions that we do with people on the front line, when we talk about technology, we talk about there's a resistance of people saying, I don't use technology. And then you say, but have you got Facebook? Have you got a Snapchat account? Are you on TikTok? And they go, yeah, of course I have. Well, that's technology. That's where we're at. So make sure the language is right. That's really important for workforce and training. So we actually asked the question, the workforce is constantly evolving. What in your view is the primary area where investment is needed to meet the demands to put on them? Paying conditions, technology to support the delivery of their services, training, pathway redesign, or technology to support the service user. This was an interesting split in terms of answers. 44% went with paying conditions, and obviously we know we need better paying conditions, certainly in social care. But the second most answer was technology to support the delivery of care. So 33% of people felt that was the primary piece. Training and pathway redesign came in at 11% each. So a bit of variance in that answer, but clarity there around let's pay our people better, let's give them the tools to do the job, and put that in the right place, and then train them. We also looked at budgets, and we talked about budgets are shrinking, demand is growing in volume and complexity. Where should ICSs focus their budgetary strategy? And the kind of the options we had here were community-based preventative care, discharge support programs, training, evidence creation, and staff numbers. And again, over 40% of people felt that we should be around those community-based preventative care programs. So that really that comes back to that investing now to realise benefits in time, which I think we covered earlier this morning. Discharge support, which obviously is the headline maker. It's the thing that gets talked about a lot at the minute. Actually, that wasn't necessarily thought as being the primary opportunity where budgets should be done. Training and evidence creation. The data's already there. How do we actually manipulate that data and provide the evidence? Staff numbers didn't get any votes. Interesting. Of data enables us to look deeper into our challenges and create solutions. As it stands, my organisation is set up to both understand and take advantage of that data that can be provided from third parties. Overwhelmingly, 100% of people said yes. So willingness to use data, I think, is the overarching thing that's coming out of that, which is great. How they do it, different question. Have they got the skill set of the tools? Again, different question, but the willingness is definitely there. And then finally, we talked about co-design and implementation. And kind of the theme here was to realise a system-wide impact, we will need to collaborate across health and social care. Deploying a preventative strategy supported by technology into social care is an opportunity for ICSs too. And we covered this morning, didn't we? There's that, how do we break down the silos? How do we look at different needs? What's the thing about trust? So address the workforce issue, deliver population health outcomes, release the burden on discharge, make the biggest impact for service users, and realise budget reductions. 57% of people felt this was the opportunity to address the workforce issues. So again, back to people, processes, training, making people feel wanted, making people have the right tools for the job. Absolutely, that's where the collective feel that we should be focusing, ICSs should be focusing their strategy and their budgets on. So, good non-technological answers. I think that's the thing here. We're not saying we've got to bring shiny new objects to market. We've got to utilise what we've got and better inform our people to be able to do their jobs. So those were the kind of the key themes. So it was a great session, good range of people contributing, and I think everybody went away feeling that actually we could do something. It wasn't all doom and gloom, and actually there was opportunity there to create momentum in the market, and actually it's about doing stuff.
So Simon, would you like to come up? And I know we'll dial in Liz as well, who I think is on the Zoom link, I think. Yes.
I'm on Zoom.
Excellent.
Oh yeah, there you go.
Here we are.
Hi.
So I'll let Simon kick off and then bring Liz in.
So we had a session which was called Personal Data Health Sandbox, and it included sort of pro-innovation regulation within that as well. And it absolutely brought to light key questions about the word exposome. So we're talking about this as a data set as much as anything of the exposures in our life. So we started with a discussion about personal data, which is, and there is a world coming of personal data intermediaries and stores where you can control your own data more than today. And that can have in it your health data, your NHS record. We showed an example of that live on my phone. Also showed the live data store with financial bank data, and a whole set of data sets that you can gather about me. But it led to an interesting discussion, which was because there were others in the room coming from a different place and a different experience, where, hang on a minute, you've got all the air quality information. Well, that's not at my personal level. You've got all the data on people on the alcohol prices in an area. That's relevant to the exposures of your healthy living. So there is a definite challenge for this mission, which is a good one, which is we need to become excellent as a society, and this is a key role in how do we pull together these relevant data sets? What are these data sets? And then Liz, I'll hand over to you, and you can talk about within the personal data, the trust, citizen in control type dimensions which we talked about, because it's not just the data, it's how do you trust giving that data?
Fantastic, Simon. Yeah, just we did touch quite a bit on trust and how do you construct trust to enable people to share their data. So in a world where 75% of the world's population will be within regulation that empowers them with their data, if they can then get to that data, how do they share that data? And one of the key enablers of that is trust. I can now see myself duplicatively. That's really strange. But anyway, is trust. And there are various components to trust. Lots and lots of work has gone into this across multiple sectors. And there's transparency on what's happening with data. And there are really interesting technologies around how to make that transparent and also how to audit it. And so that people do know what's happening with their data and technically know, so they don't have to watch it, follow it, etc. They can just be exception reported. There's a lot of work gone into consent mechanisms, and people like Visa, for instance, are looking at how do they design consent to enable people to make informed choices and contextual choices. So some of these are in-journey choices where you're actually contextually offering consent. So transparency, control, consent are key to creating trust in how that data is shared. And there's also something around the ability to dynamically rescind control and rescind consent, and something around how you can actually slice and dice your data. So it's not about giving all your data, it's about giving the data that is needed and relevant in the context. So it is a central piece, and it will need to be looked at around how to create that trust, and it is contextual, so we'll need to choose the right use cases to study, I think.
Thanks, Liz. Thank you so much. So I know it's been a long day, and I'll just say a few words, and then Nick and then you'll come up and make closing statements. So yes, I was in the sandbox exercise, which was fascinating, and I think one of the ways in which we'll make this mission happen is forming these sandboxes, and we covered off obviously a lot of areas around what those sandboxes need to cover. But I think the one thing that seems to come out so loud and clear is that the pace of change and the exponential acceleration of stuff that is happening at the cutting edge of science technology is only going to increase, and it only highlights more and more how we need to come together and work this out in terms of what are we all trying to do together as a society around shared goals. So I think, in that spirit, I think what that is at the heart of obviously what we're trying to do with the mission. And this event today was actually just to start the dialogue, the wider engagement, not just with this sort of health tech ecosystem, which effectively pretty much represents us here today, but of course the citizens who are here today, but it's everyone, in society we have to engage. So this is a starting point of that engagement process. I mean, we had a little bit of a joke, does anyone know what the exposome, what does that mean? What does quantum mean? Yes, language is important. We all need to talk the same language, but actually more than anything, we need to share the same goals, and then with that are the incentives to actually work in a way that will deliver on those goals. And we know that money is a really big part of this. So obviously, we are on a massive fundraising drive and are looking and exploring all the different avenues to fund this mission and to make sure that that funding is made available to the wider tech ecosystem in a smart way that reduces the duplication that we see everywhere. There is so much good work, but it is being duplicated everywhere. And it is astonishing that in one session, with not that many, there was just a few of us in the sandbox, but it was quite extraordinary how much everyone knew about all the different places we could find the domain knowledge, the data sets. And those are the sort of discussions that we have to be having, around, well, what can we do to actually make a difference? So this is the first of 4 that I know we're planning this year. And obviously, we're working with UKRI in terms of wider engagement with obviously the UKRI ecosystem and making sure we're building for the future, in terms of all the wonderful work that has been happening, with UKRI and elsewhere. And so I will hand over to Nick and Lynn, but an amazing day, and thank you so much for everything that came out of it.
Well, first of all, let me thank Tina for all the job she has done. Tina Woods, thank you so much. A big applause to you. Thank you, Tina. Tina is an engine of connections, and so see us as a hub of putting together your needs, your ideas, your intentions. That's what we are aiming to do. We're an enabler here. So we're enabling everyone who is interested in bringing forward this narrative to the possibilities of try to make something happen. That's something that I guess is important to remind to us. We have a quite strong mission of delivering, not only talking about this thing, and prove that it's doable. Just a few things. I have to thank you for being here for the whole day. It's been a long day. We're not few left in the room, but I think it's great to have you had here in Newcastle, because I think from here we try to drive a change that it's connecting so many dots. Also, I think we try to do the things slightly differently, focusing a lot on how to make the things happen, because the what, I think it's clearly all around us. My last point, it's about, I think there's this dichotomy, Nick, you just said before. We keep on saying people and technology, just like these two things, are separated, which I think is something that probably should have to overcome quite soon. We all know what we like. We all know what is good or bad. It's quite clear to us that the technology is not something outside from ourselves. It's just in the daily living. It's in everything. So the point is that we have to be able to translate this thing properly. I'm not saying that if for the sake of the people is good, and when you put technology and then it becomes a sort of a different story. It's one story, and we have to be able to leverage the both at the best way, which I guess it's probably the best thing we can do together, because the purpose is quite clear to all of us. And as Tina said, it requires support. And again, I think also smarter ways on how we can use the data on one hand and use the funding on the other. There's a lot of opportunities out there. Sometimes we don't see them correctly. So I think it's also for us just to find better ways on how this system could be enabled by the advantage that can bring to society and to people. There's still that we have to invent, and I was really happy we had also have MasterCard in the discussion today, because as a big player, it sees from one perspective, but they clearly told us at a specific question we asked, first, are you understanding, let me say, health outcomes from the spending of people, which obviously the answer was yes. The point that we could ask them, did we ask you to do it? So the trust is a big point. And the second, if they see if spending system could help also the health of the people. So think about an entity, MasterCard, is touching billions of people. Therefore, we have to look at them as players that could enable a certain kind of mechanism that, again, I think requires all our intelligence to be put in place. So thanks for being with us. I think you'll see some good result soon. Lee.
So just to echo my thanks to Tina and to Helen and team, but also just to say, the essence of the mission is the quantum leap. And we discussed at the start, this kind of confusion sometimes with quantum computing. But at the end of the day, I think what has come through every conversation we've had today is that commitment to more pace and more scale. The other side of it, of the mission as well, is that we have to radically reimagine. And that's really hard when you radically reimagine what's possible with all of this that tech and AI and data can actually unleash for us, with that practical of, well, what does it actually mean in terms of delivery? That can be challenging, but that's where the collaboration, actually the join up of thinking and that interconnected ecosystem of different organisations and different kind of possibilities really come together. So at the heart of everything we've discussed today is how to deliver meaningful collaboration, not reinvent the wheel and duplicate effort, but to really come together, because the possibilities are just enormous. And, really looking forward to the next sessions. This is just the start of the conversation. We'll try and sort of summarise the day and sort of share that with everybody. But I think we're all taking away that message of collaboration and join up, but also the ambition and the aspiration of what is possible for healthy longevity when we can actually achieve and deliver together. So thank you so much for coming today. It's been a pleasure to see you all, and see you at the next event very, very soon.